So if you're watching this video, we likely talked about a strabismus or esotropia, exotropia. Esotropia is something along those lines. Exo, I don't have the skill to turn my eyes out. But so the eyes turning. Now, I want to dispel a little bit of a myth first. So a lot of patients have came to me telling me that it's a weak eye muscle problem. It's not an eye muscle problem. If it was an eye muscle problem, that it's too weak, then how is the eye able to turn right, turn left, turn up, turn down? Now, I understand there are some situations like a Duane syndrome, and so I'm not going to go into a deep dive on all of those. Some of them legitimately are a muscle issue, a muscle connection issue. But most of the time, atropia isn't a muscle issue. It's a brain connection. The brain has decided for one reason or other that it's not as advantageous for us to use both eyes when we're looking at something, and that this is easier for us. And so the brain will shut off one of those eyes so that we're not utilizing it and seeing double image. And so an easy fix with these things can be prism. I can put a little bit of prism in the glasses and cause the eyes to shift out. Another treatment option would be vision therapy. Now, I've done a video talking about Brock string, which is my favorite way to treat these things, and I'll link it up here for us. And Brock string vision therapy type things can be beneficial. If it's a really large deviation, then I may even talk to my patients about surgery. But the difference is I can't untoast the toast. So once you've gone and had surgery, I can't undo the fact that we had surgery. And so I usually like to try prism in glasses or vision therapy before I go down that last resort thing. And majority of patients that I've seen clinically can be fixed with just vision therapy and prism glasses and don't need to go that surgery route. But there are a handful that do. And so what do we do with vision therapy? It's not a quick fix. It's not one day, one time, one thing. A lot of the vision therapy determines on whether or not we've had this for 3 months, 3 years, or 35 years. And what I mean by that is it's a lot easier for me to help out an 8-year-old than it is for me to help out an 80-year-old. The 80-year-old's more set in stone with their visual system. That 8-year-old's still very malleable. And so there are some variances there. Now, I'm not saying surgery is a bad thing. I'm saying it's not my first line of treatment that I like to go to. And so understand that it's not a big deal that the eye's turned in or out. We can fix it, okay? And so if you have questions, want to talk more about it, I'm always here. Leave your questions in the comments.